Hello, my name is Sonia Ward, and today I will be talking to you about dementia. So in this presentation, I'm going to be talking to you about what dementia is, dementia and cognitive impairments, quality of life reported by caregivers versus patients, subjective memory complaints as a useful tool for the early detection of Alzheimer's disease, and of course, my conclusion. So when we talk about dementia and cognitive functioning, it's always important to include how a patient rates their own quality of life, and it's important to value subjective memory complaints from patients as a tool in evaluating to what degree a patient's cognitive impairments are. So what is dementia? Dementia is a term that describes a variety of symptoms that affect a person's cognitive functioning, including their ability to think, remember, and reason. Dementia occurs when nerve cells in a person's brain stop working. There are many types of dementia, but the most common is Alzheimer's disease. Our book tells us dementia is a disease that impairs a person's brain functioning and cognitive abilities. There have been surveys done to determine what elderly people say about their memory loss. Many of them reported simple things that most of us take for granted, such as forgetting a person's name, phone number, or a place that they usually go to. They also reported that their decline in memory issues went up each year. There also was many elderly people that just don't report memory issues, period, because most of them believe it's just part of growing older and aging, so they don't report their memory issues. So the first study that I looked at was with Hahn and Associates, and it was published in 2016, and they wanted to determine the quality of life reported by patients versus caregivers. So this is an important thing to consider. They found that quality of life reported by patients was actually a better determining factor as opposed to caregivers, because caregivers can actually be biased in their reports. They can actually even project their own feelings or own views on their lives onto the patient's quality of life, and this of course is going to skew the results. So there's Hahn and Associates also determined that cognitive decline of patients with dementia does affect how the patient interprets their own lives. And there's a thing called anosognosia, a little bit of a tongue twister there, and it's basically a lack of insight. It's a symptom of severe mental illness that's experienced by many people. It basically hinders how they see their disease or how they see their illness. It can be like a person with dementia that just doesn't believe that they have any memory issues or dementia. So therefore that affects whether or not they're going to take medication or get any type of treatment for their illness. So when this was high in patients, their quality of life the rating was high as well. And when it was low in patients, they rated their quality of life lower as well. So when they knew what was actually happening to them, they rated their quality of life accordingly. In this slide, there is also 3 brain images that you'll see in the top right-hand corner of the slide. The first one is of a brain image of a normal brain. The second is a person with mild cognitive impairment, and the third is a patient with Alzheimer's disease. You can clearly see how from one brain to the next, the deterioration is obvious. So Hahn and Associates in 2016 made this chart. It's a quality of life ratings for people with dementia, but specifically in the area of their memory loss. So you can tell that by the chart that as the impairment got bigger or more significant, so did their ability to remember things. My second study is by Cho and Associates, and it was published in 2018, and they wanted to decide or determine whether or not subjective memory complaints would be a good tool to predict mild cognitive impairments and to predict early onset Alzheimer's disease. So in this study, Cho and his associates, they found evidence that supports that subjective memory complaints are in fact a reliable indicator of cognitive decline in Alzheimer's pathology. They found that gray matter atrophy patterns occurred. This is where most of the brain's nerve cells are. They also found volume loss in the hippocampal and parohippocampal area of the brain. They did also find evidence of amyloid burden, which is plaque that builds up outside of nerve cells and causes the brain to not function properly. Again, this is a picture of a normal brain, and then it is side by side with a brain with Alzheimer's. You can clearly see that it looks like things are missing and the brain actually is shrinking with the Alzheimer's. Cho and Associates also did a graph to show how subjective memory complaints are compared to the mini medical state exam. The graph shows that subjective memory complaints were actually a little bit better in determining, or as a tool in determining, cognitive impairments as opposed to the mini medical state exam. So while we are still learning how dementia affects the brain and cognition of patients, there are some things that we do know. We do know that subjective memory complaints are an important tool to gauge whether a patient has normal cognitive impairments versus mild, moderate to severe impairments. We also know that subjective memory complaints can identify early onset Alzheimer's disease, which is very important, and that quality of life self-reports help identify cognitive impairments and brain damage in elderly patients, or in patients, period. So in conclusion, the studies that I chose to look at, or that I have discussed in this presentation, they actually don't contradict each other. In fact, they support each other. That is my presentation. These are my references, and I thank you for your time.